Okay, so um, at some point we were talking about I don't know what video it was, but we talked about this problem where it was about the physician's health study. It was studying, the effects that certain pills may have on um, uh, the people participating, whether they were getting cancer or heart disease. Okay, and we talked about the idea of placebo. So then I introduced to you guys the idea of it, and we said that a placebo was a dummy pill. It's an inactive treatment. Okay, so the logic of a randomized comparative experiment depends on the ability to treat all the subjects in the same way, except, of course, for the actual treatments that um, are being given. So, good experiments would require careful attention to details to ensure that all subjects really are identical or being treated identical, that is. If some subjects in a medical experiment take a pill each day and then a control group takes no pill, the subjects aren't really being treated identically. Of course, they're not going to think that. Um, they see an effect, and the others will think that they do have an effect because they're taking a pill. So, many patients would respond favorably to any treatment, even a placebo. So, perhaps they trust their doctor, so that's why they react to a dummy pill. The response to a dummy pill would be called the placebo effect. So, here would be a good example of where you see the placebo effect happening. Want to help balding men keep their hair? Give them a placebo. One study found that 42% of balding men maintained or increased the amount of hair on their heads when they took a placebo. In another study, researchers zapped the wrists of 24 test subjects with a painful jolt of electricity. They then rubbed a cream with no active medicine on the subject's wrists and told them the cream should help soothe the pain. When researchers shocked them again, 8 subjects said they experienced significantly less pain. When the ailment is vague and psychological, like depression, some experts think that the placebo effect accounts for about 3/4 of the effect of most widely used drugs. Others disagree. In any case, placebos work is a good place to start when you think about planning medical experiments. So the strength of the placebo effect is a strong argument for randomized comparative experiments. In the baldness study, 42% of the placebo group kept or increased their hair, but 86% of the men getting new drug to fight baldness did so. The drug benefit beats the placebo, so it has something besides the placebo effect going for it. Of course, the placebo effect is still part of the reason this and other treatments do work. So, um, maybe had this up before. So, sometimes it's foolish to tell doctors and other medical personnel who is receiving the treatment. Um, uh, so not only should some think that they are getting a treatment when they're not, but sometimes the doctor shouldn't even know who is receiving um, the dummy pill or the active pill. So if medical professionals know a subject is getting just a placebo, they may treat them differently because they're not expecting to see results. So they may be more compassionate towards or attentive or nurturing towards the ones that are getting the active treatment, and the placebo may not be treated the same way by the doctor. So whenever it's possible, experiments with humans specifically should be double-blind. In a double-blind experiment, it's only the statisticians that know who is getting what before the end of the experiment. So the idea of a double-blind design is simple. Until the experiment ends and the results are in, only the study's statisticians will know what treatment was given to who. So, however, some experiments cannot be carried out in a double-blind manner. If researchers are comparing the effects of, let's say, exercise and dieting on weight loss, the subjects obviously have to know what treatment they're getting. They have to know if they're exercising or they're dieting. So that experiment can be single-blind. So if the individuals who are interacting with the subjects measuring the response variable don't know who was dieting and exercising, but obviously the experimental units, the subjects, would know. So it's only single blind, not double blind. In other single blind experiments, the subjects are unaware of the treatment they are given, but the people interacting with them measuring the response variable, they would know. And that's it for this video.